we're talking about heat-related illnesses, heat exhaustion, even death due to heat, which there are more than 600 deaths, I believe, in the country each year due to heat-related problems. And Dr. Paul is here with the Metro Public Health Department. Thanks for coming in.
It's great to be here. Thanks.
You know, you think this is something, gosh, this is so preventable. How does this happen?
Well, that's a good question because it is preventable, and yet people do die every year from exposure to heat. And so you have to take it seriously. And I think one of the things we especially have to do is think about who's vulnerable and make sure that we're protecting people who are vulnerable to the effects of extreme heat.
And who is it in our population? You know, you always think of the elderly, but beyond the elderly.
Yes, certainly seniors and people who are socially isolated. Oftentimes when there are heat-related deaths, it may be people who are struggling with addiction, or they may be on medications that make them especially susceptible. So those are some of the things that can do it among adults. But then very young children and infants are another group that's vulnerable. And you know, the one thing that you hate to hear about, and we always remind people about, is making sure that infants or children are not left in a hot car.
Oh my goodness, yes. And your pets too.
Pets as well.
Pets too. Okay, so what is the difference between heat exhaustion and heat stroke?
Well, you know, this is something that is interesting to learn and maybe a little bit hard to remember, but we'll talk through it a little bit because heat exposure to extreme heat can cause milder illness and more severe illness. And so heat exhaustion is on the milder side, even though it can be very serious. People are sweating profusely, they're losing fluids from all that sweat. They may be nauseated a little bit. They may have a kind of a thin pulse, and they might start to feel clammy. That would be heat exhaustion. Of course, fatigue, of course, weakness. For heat stroke, it's a much more serious situation, and so that's where the body temperature goes up above 103 degrees. People lose the ability to sweat. Their skin is red. It's dry. They may have a pounding pulse, and then the symptoms of changing consciousness or even seizure can set in, and that's a medical emergency. It can be deadly. So
would people typically, though, go through those other steps first before they got to the deadly situation? Would they be weak and have clammy skin and then go into the, you know, pass out? That would be the progression.
Most often, yeah.
Okay, so what do you do if you find somebody in that state?
Well, I think if anybody's significantly ill from heat exhaustion, you're going to want to call 911 and get some assistance right away. But the basics of it, both for prevention and for treatment, one is if they can drink, give them something cold to drink. Get them in a cool place. If there's no air conditioning, that's clearly preferred, but at least get somebody into the shade. So it's really hydration with water or a sport drink, and getting people into cooler surroundings and to cool them off. In the more severe cases, you may need to use ice. You want to expose as much skin as you can to the cool air. Those are some of the things to kind of lessen the impact of that overheating.
Okay, and I don't know if we put this up on the screen yet. I didn't look over here about the heat stroke symptoms. I know we had the heat exhaustion symptoms, but if we didn't, we could have those up again. So you talk about the high body temperature.
Right.
What is the temperature? There they are on the screen.
There we go,
above
103 degrees, and red, hot, dry skin, rapid, strong pulse, throbbing headache, nausea, dizziness, and possible unconsciousness. So people may get combative, people may have a change in their mental status, and that's all signs of a really severe heat stroke.
Let's talk about people who choose to be outside for recreation or for running, jogging, playing tennis or golf, or really exerting themselves in the heat, maybe on pavement. What are your recommendations as far as limiting your activity when it's hot?
Right, it's important to know that this can be dangerous, and so for people who are really doing something recreational, oftentimes you'll try to do it in the early morning or in the evening when it's cooler. Limit the amount of time, have more realistic expectations of how much exertion you're going to do. And then you're seeking hydration, and you're seeking shade, and you want to do everything you can to stay cool. Now, some people have to be out in the heat because of work, and so it's important for the boss, for the employers, to be aware that there can be illness and danger to being in extreme heat for a long period of time. So again, hydration, shade, periods in air conditioning or in a cooler spot.
And wearing clothing that can breathe too, right?
Absolutely.
Covering yourself, but clothing that can breathe.
Yes.
Okay, also, what are some other safety tips then for people outside, besides drinking plenty of water? I know we touched on don't leave a child in a hot car, not for any length of time.
Yes, that's always tragic to hear about, and it is amazing how fast the air in a car heats up and how much damage can be done in a short period of time. Pets too, another situation where you can see tragedy in a short period of time.
Sure. Also, I saw on our list, you know, like we talked about earlier, check on if you have elderly neighbors or someone that you know tends to stay home a lot for whatever reason, like you said, whether it's addiction or other problems. Check on your neighbors and be a good neighbor. Yeah, you know,
for heat-related illness, the basic message of stay hydrated and stay cool is one that most of us really understand.
Yes.
So then we really have to be looking after the vulnerable. And who's vulnerable among us? Well, it is the seniors, it is the very young. Then there might be people who are socially isolated, or people who are trying to say they can't afford the air conditioning bills.
Yes.
So you need to look in on your neighbors and make sure that they are able to stay cool when the heat outside gets extreme.
All right, Dr. Paul, thank you.
Thank you. It's been a pleasure.
This time of the year, thank you so much. And we'll be back with more after this.